I've had doctors tell me that it is the vaccine, but they can't write things like that because there's not enough research out there to say this is the vaccine or this isn't the vaccine. I had the first one in January 2021 and then my second one in February. No problems with the first one. This was Moderna. And then within 36 hours, I started getting nauseous. And then the day after, I started having trouble breathing. And I do have asthma, but it's been very well controlled. So I thought maybe my asthma's flaring up. I wasn't putting two and two together.
Okay.
And then it progressively got worse. My inhalers weren't working. And by the 5th day, was in the hospital. By a week after, was on the vent. So had a severe respiratory reaction and ended up on the vent 5 different times. The last time they put a tracheotomy because I was having spasms in my throat. Still do randomly, and they cut off my breathing. So
when the spasm happens?
When the spasms happen, they couldn't pull me off the vent because they were occurring at that point too. I've had GI issues where I've had to have a feeding tube at one point. I've had like urinary issues where I had a catheter implanted in my stomach. I've had blood clots, infections, neurological issues that have caused weakness, difficulty walking, just a whole slew of things. Seen several different specialists.
I'm sure. Where are you right now with your health versus when this all first started going down? What's that kind of journey looked like?
I'm obviously better from the standpoint, I'm not to the point where I'm having trouble breathing, needing to be in the hospital. I am in pulmonary rehab right now. I've just, over the last 2 weeks, weaned off oxygen. As far as my overall health, I have issues with, different things I eat. Breathing stuff still is a stamina thing. I get out of breath a lot. I can't walk long distances.
I was just going to ask, you're in the wheelchair,
Yes.
so you can walk.
I can walk short distances, like room to room in a house. It's very uncoordinated. I can't place my feet in the right position that I want them. And they were saying that they thought maybe it was a neurological disorder, but they can't peg which one that it could be. And so I've just had a lot of unanswered questions. But as far as overall health, better than I was, but good days and bad days.
Okay. Do you feel like you're on the upswing to some degree still?
Some days I do, but then some days I don't. So
Some days you feel like you're
I'm not
going
really sure. I
backwards?
think I'm at a kind of a plateau point of a up and down right now.
Okay. So the neurological, I assume they've run the MRIs and looked at MS and those types of things and tried to rule things out.
We've done MRIs, CTs. They've done muscle tests. We were looking back at all the blood tests and all the tests they've done, and it seems like they've ruled pretty much all the typical progressive neurological disorders out. There are a few extreme tests, such as like spinal taps and stuff that they haven't done yet. But they're kind of throwing their hands up and saying, I don't know.
What type of specialists are you working with right now?
Well, up until about 2 to 3 weeks ago, I was working with a group of doctors out of Nashville. And I still am for maintenance, but I feel like that I kind of reached a point where I was just being managed and no one was really coming up with answers. It's just like they're not looking at my past, they're looking at me now, trying to fix me now without figuring out the source. And so here recently I've been connected with a doctor, Pierre Corey, and we are trying some different things and going a different direction.
Okay. So then with you said trying to nail down the source, have you had anybody admit to a belief that it is the vaccine that caused this?
I've had doctors tell me that it is the vaccine, but they can't write things like that because there's not enough research out there to say this is the vaccine or this isn't the vaccine, because they said it's all experimental. I've had some doctors say None of them have said, no, it's not the vaccine. Most of them ignore it and skip over it, or they put it in the subjective portion of my patient notes saying patient reported after vaccine. But, there are a few doctors that, will report in there that says, this occurred after the vaccine. But as far as my diagnosis as different things, they focus more on what's going on now.
So they're looking at symptoms a lot more than they're looking at a cause.
Right.
And how does that feel to you when it sounds like it's being dismissed for the most part?
Well, coming from a healthcare background, I'm a physical therapist.
Okay.
To me, it doesn't seem to make sense. In order to find out what's going on now, you've got to find what's behind the source.
Right.
In order to investigate. And like I said, I have a GI doctor, I have a urologist, I have a pulmonologist, I have a neurologist. I have all these doctors, and they're all working on separate systems, and no one is working on a collaborative, systematic approach. And so I feel like, Dr. Pierre has started doing that, but I feel like that by ignoring that, they're missing the big clue of what connects it to maybe what can fix it.
Yeah. What led you to Pierre Corey?
By putting my story out there on social media and just connecting with people. There was another vaccine injured lady out of Florida who reached out to me and knew Dr. Corey and just said, hey, can I get you in contact with him? And one thing led to another, and within a couple of days, we had set up an appointment.
And you just recently started with him?
Yes. Now, I was coming from the world of Western traditional medicine, and that being my educational background, I was fully invested in that system. I believed in it. I supported it. But through my experiences last year and through the experiences I've gone through, it wasn't until here recently that I was ready to accept an alternative route. And I think everything just fell into place, honestly. When I was ready, it just seemed like everything was there.
Okay.
So.
What were your thoughts going into the vaccination itself?
Yeah.
Any concerns at all?
Yes. I did have concerns. I thought this is pretty quick. They came out with a vaccine. I really haven't gotten a whole lot of research on it. You haven't heard a whole lot. They're pushing really hard. But my fear was, that I was working with a home health agency. I was working in an assisted facility where they were vaccinating all the residents. And I assumed at that point it wasn't mandated, but it was about to come down the line to be mandated. And so it was just a matter of time. So when that first batch of the healthcare providers went to get it, I thought, well, let's just get it out of the way. And I was hesitant, but I went against my better judgment, and I did it. First one, I was like, okay, it's fine. Didn't hesitate about the second one, and it was the second one that threw me off.
How long was it into the process of your injury that you recognized that you weren't alone in this, that you weren't a rare case?
That happened in mid-February. It was pretty critical for the first 3 weeks. And probably about mid-March when I really started to reach out, there was a few cases here and there. There was one that reached out to me in Kentucky where her mother was severely injured on ventilators and who had passed away during my time. And that kind of first led up. And also while I was in the hospital, nurses would come in at different points and would be like, you're not the first case we've had. We actually have someone across the hall that, or someone in this unit that has been vaccine injured, without giving details.
Right.
But that kind of made me question, but it wasn't until about March to April when I had a mass flood of people after I started releasing more about me. And then towards summer and the end of the year when I started speaking out more, it really became apparent how many there were.
What made you decide to speak out and not stay quiet and just worry about your own health?
At first I felt, like if I were to speak out, it almost was like you're being judged. And even when you talk to a doctor, it's kind of like it's a hush-hush situation. Mm-hmm. Are you putting your job on the line if you go against the vaccine because you're not supposed to do that? It's kind of an untold thing. But then as I started to see how many people there were out there and how much it was hurting to be neglected and how frustrating it was to not find care and to not find help and anybody that would listen, that's when I realized, I've kind of lost my purpose and identity. I can't do my job. I can't go back to work. I'm going to fight for what I can. And that's where I wanted to share my story.
Thank you for being willing to do that. That's huge for so many people. Through this whole process, I know you have children. What's it been like for your family, and how has that looked?
It's been rather difficult. I have 3 children, and first when I came home, it was kind of questions, what's that tube, what's this, what's that, and a lot of explaining. And it was very hard. I could see their frustrations. We found that humor is our best coping mechanism at home with our kids. And I can tell it comes through, even though things aren't directly said about the situation, it comes through in misplaced anger and frustration. And, when you have to rearrange your lifestyle because you're used to a professional income down to lost your job, it's a big change and adjustment. So I think it's been very difficult, but I have 3 wonderful kids that I think are adjusting. And then my fiance, she's struggling through med school right now trying to help me through all of this. So it has definitely been a challenge for her. I feel guilty at times, but she's persevering.
Do you feel like it's a humility from the situation that has occurred and an understanding of the true level of your humanity and the value of your life that has changed things? Have you felt that change?
I do believe that is definitely part of it. At one point, I guess it was right before the 3rd time going on the vent, I thought, if I go on, I'm not gonna pull through. And I remember thinking this could be it, and I was using that last little bit of time to record videos on my phone for my kids, my fiance, because I thought I wouldn't be able to tell them that. And that feeling that you have, that feeling is never lost, and that gives you value to your life.
I'm sure.
Much more value. It doesn't mean that you hate the situation that you're in right now.
Sure.
But it gives you more power to fight for it, and strength.
What brought you to LA? It's not easy for you to travel.
No,
right?
It's not.
You're here for the Defeat the Mandates rally. What is your ultimate hope in terms of what we're doing here this weekend?
To bring a voice to those that are injured, to speak out, to make people aware. We are not rare. We are real, and we are being ignored. We are being silenced. And the problem with that is now it's leading to people having a lot of emotional issues. I mean, there's been some recent suicides, and that it breaks my heart to hear that people get to that point. But it's because we're being ignored. We're not finding help. So I think to bring awareness and to plea for more funding for research, for treatment to help us, even if they can't find a solution, to not ignore us.
Right. Well, the first step is not being ignored, right, before there can be a solution found.
Yes.
For sure. What else would you like to share with whoever's listening right now?
I guess if you're out there and you have been affected by the vaccine, whether it's yourself or a family member or a friend or anybody, don't be shamed into not speaking out. Because if you don't speak out, then it's almost kind of like a silent consent that you're saying it's okay and you're being belittled. But if you have a voice, we have power in our numbers. And absolutely. I think that's the only way we're going to be heard, because at some point they can't deny our existence. And at some point they'll have to say, okay, yeah, there's been people injured. We have a problem. That's the only way it's going to happen.